Thank you, and I want to thank the organizers of the committee for welcoming me back again this year. It's a very fun meeting for me to be at. So I get the opportunity to debate the FOLFIRINOX bevacizumab arm, part of this debate. Sorry to disappoint you. This debate may be a little less catty than the prior debate, but I think we'll find it interesting. So we all know and are very familiar with our patients with the clinical behavior of BRAF mutations. We know that BRAF is a downstream signaling from RAS in the RAS-RAF-MEK-ERT pathway. We know that it occurs in anywhere from 4 to 14% of patients, depending on which study you read. And in general, it's mutually exclusive with KRAS mutations. We know from studies that have been done, molecular studies that have been done, that this is patients with BRAF mutations, their cancer behaves biologically very different. And we see that in the clinical results as well. The picture on the right is a Kaplan-Meier survival curve from the PATAC-3 data. PATAC-3 was an adjuvant irinotecan-based study, and when they looked at survival after relapse after the PATAC-3 study, you can see dramatically worse outcomes for the BRAF mutant patients, looking at about 7.5 months of overall survival versus 25 months for BRAF wild-type patients. We also have data on this from another study, the PRIME study, which compared FOLFOX and panitumumab head-to-head, and we see in good performance status patients there is indeed a benefit. But when you compare the BRAF wild-type patients to the BRAF mutant patients, again, in terms of progression-free survival, we're seeing dramatically different outcomes for these patients. So I think we've got a lot of data here to confirm what we see in clinic with these patients. They're often very sick, their cancers are very aggressive. It's frustrating because you treat them and they don't respond very well to anything. So from my perspective, I think given that these cancers have such an aggressive biology and they don't respond as well to typical treatments, we really need to focus on improving outcomes for this specific, although small, patient population. And I think that we should take an approach similar to pancreatic cancer, which has a similar aggressive biology and resistance to treatment. And we do have some clinical trial to support a more aggressive kitchen sink approach for patients with BRAF tumors. So the data comes from the TRIBE study. So this was a randomized clinical trial looking at patients with first-line metastatic colorectal cancer. And they were randomized to receive either FOLFIRI-bevacizumab versus FOLFOXIRI-bevacizumab. And primary endpoint of the trial was progression-free survival. And when we would look at patient characteristics, they were very similar among the two arms. Now, when we look at the safety data from this trial, in terms of, go back here, grade 3-4 adverse events, as expected, patients had significantly more diarrhea, stomatitis, and neutropenia, but actually febrile neutropenia was not significantly increased, so that's kind of a plus. Numbers go down, but maybe not as clinically relevant. And we look at progression-free survival. There was a significant improvement for the FOLFOXIRI-Bev arm among all patients compared to the FOLFIRI-Bev arm. Response rates were also significantly increased, 65% for the more aggressive regimen versus 53%. And when we look at the updated results for overall survival, again, we're seeing in your 4-month improvement in overall survival for FOLFOXIRI-Bev patients versus FOLFIRI-Bev. Now, when you look at the subgroup analyses of this trial, one thing that really sticks out to us is the BRAF mutant patients. That's a very small number, 28, but look at how that hazard ratio, 0.55, compared to 0.84 and 0.83 for the KRAS mutant and wild-type patients. And that indicates to us that there's probably a signal that this patient population is getting more benefit from an aggressive approach. And when we look at results based on all wild type, either RAS mutations or BRAF mutations, and we look at progression-free survival just in the lower row, 5.5 months with the bevacizumab FOLFIRI arm versus 7.5 months for FOLFOXIRI with bevacizumab. We look at that overall survival, a near doubling for patients with BRAF mutations. So I think that these results give us a signal that patients with BRAF tumors may benefit more from an aggressive approach. We also have 2 phase 2 trials looking specifically at the FOLFOXIRI bevacizumab combination for patients with BRAF mutations. Again, these are small numbers, but understandable given the relatively low frequency of BRAF mutant patients. So, sorry, the top got cut off there. So for this trial by Masi et al., reported in 2010, they broke down results depending on KRAS status and BRAF mutant status, and just kind of blow up the BRAF mutant curves there. And we can see that with the use of FOLFOXIRI bevacizumab, the progression-free survival was very similar, and the overall survival was very similar as well. And the second trial reported by Loupakis et al. In 2014, again looking in terms of progression-free survival, which are the top curves, and overall survival, which are the bottom curves. Between the slide on the left is the BRAF mutant, slide on the right is BRAF wild type patients. And again, fairly similar numbers in terms of progression-free and overall survival. And I made this table just kind of as a comparison to the historical controls, looking at 7.5 months overall survival with a doublet biologic regimen, and improving this to almost 2 years with a more aggressive approach for BRAF wild type patient or BRAF mutant patients. And I think that's these are all very good signals that these patients can benefit from more aggressive regimen. So in conclusions, I do think that we need to treat this disease with a much more aggressive approach. I think FOLFOXIRI Bev, it offers a dramatic improvement over our traditional approach of a doublet chemotherapy regimen with a biologic. And I think, clinically when we see these patients, oftentimes they are very sick. And I think FOLFOXIRI Bev gives them a chance to have a quicker response to treatment and hopefully alleviate some of their symptoms that they have from their systemic disease. Thank you.